Good morning and welcome to The Crawl, the show where we break down the future of search, brand authority, and everything else AI is rewriting about the world. I'm Tristan Harris, your host, and today we're sitting down with Dr. Monique Gehry, on AI's impact in the medical field. Monique Gehry, DO, MSc, FACS, is a surgeon, C suite executive, and globally recognized researcher and expert in precision wellness, cancer treatment, and risk reduction, reshaping the future of breast cancer care with purpose. As Chief Medical Officer of BEXA, she leads medical strategy for an innovative, radiation free early detection platform designed to close screening gaps and expand equitable access to life saving care. Known to patients as Dr. Mo, she combines clinical excellence with clarity and compassion, ensuring every patient, especially those historically underserved, has both agency and a voice in their care. Her clinical appointment includes breast cancer surgical oncology within the St. Luke's University Hospital Network. Beyond the hospital, Dr. Gehry is also the founder and CEO of Still Rise Farms, a 40-acre wellness and research incubator bridging evidence-based medicine with integrative health. She is a respected voice on women's health and innovation, healthy equity outcomes, and leadership mentoring across corporate, nonprofit, and academic sectors. So, with that, please welcome Dr. Mo to the show. Dr. Mo, how are you doing today?
You know what? I'm doing fantastic. I'm really excited to be here and have this conversation. I mean, it's a little daunting the task of all things AI in healthcare, but we're gonna get through some topics, and I'm excited to be here with you because this is a really amazing and interesting podcast, and I love the work that you're doing. So, thanks for having me.
Well, yeah, and thank you so much for those kind words. I'm really interested in this topic. My mom is or was a nurse for her whole career. She's retired now, and she did nursing almost the entire career, and then she was in patient records and all that. So I have lived on the outside of the medical field, mostly hearing her complain about the day to day. So I'm really excited to kind of learn more about how AI is being integrated in medicine. And I guess to dive in, question number one, there's probably a lot of misconceptions about AI in medicine. Like when people hear that, I think that, there's probably people that are thinking, oh, they'll use it to read x rays all the way up to my doctor is going to be chat GPT in the future. Do you, do you see any trends in what people are getting wrong when they're kind of thinking about how AI is being used in medicine?
I think people are one, I think they might be selling AI a little bit short because so much of the general public knowledge, and I'll admit even my own knowledge about AI really was looking at kind of the weak features, some of the agentic features and thinking about, the chatbot and how AI can answer questions and triage patients and do these wonderful things. But it's so much deeper than that. And I think as we start to look at the levels and the layers of where AI can help, especially, I'm an oncologist, right? So I think about detection, treatment, diagnosis, research, survivorship. And so I think that we are at an inflection point where we need to educate the public a bit more about the role of AI, the safety of AI. And then I think we need to start to maybe allay some fears because there's a lot of fear about AI in general that it's going to replace jobs and human encounters. And we have that fear in healthcare among clinicians as well. So we got a little bit of work to do to make sure AI gets the fair shake that it deserves.
Yeah, and I think that there's always going to be people that are worried about how something new is being integrated, especially with a topic as important as personal as their own health. Um, but I'm sure you could probably talk about different examples of how AI is being used in screening to help in, on the oncology front to help people detect cancer earlier and help people find out if they have, risks or things along those lines. Um,
Yeah.
to that end, like, are there examples that you could tell us about or walk us through about how AI has improved patient outcomes?
Ooh. So let's start, I think, with looking at AI in early detection for breast cancer, because there is a challenge that AI particularly is adapting to solve, and it's the challenge of dense breasts. And I don't know, who our audience is, but if they're women, I guarantee at some point in their life, in their health health span, they've been told by a doctor that you have dense breasts. And it's a challenge for mammography because mammography is a density based study. So a mammogram is like an x-ray of a breast. So
Mhm,
the thickest thing shows up, the white thing, like a leg, right? You'll see the bone, but not the muscle.
mhm.
So in the breast, you see the dense, spongy breast tissue. And in young people and in women who have dense breasts, which is about 48% of the population, the mammography shows the snow cone, right? You've got all this white tissue and you can't find the cancers. And so we're looking at how AI can now not only sift through some of that background and sift through what we call the parenchyma, but it can also become now predictive to look at the tissue and the changes over time and say, hey, there might be something developing in this area. So it's really exciting to see where AI is now starting to be able to change the trajectory of a patient, meaning maybe she needs less screening, or maybe she doesn't have to come in for that second appointment because the mammogram just said it was inconclusive. We can get to a conclusion. Whether or not that changes outcomes is a little bit of a different story. So that's where it gets complicated.
And I think that you can, I think that early detection is so important with anything cancer based that if you are seeing an improvement in detection early on, then it would stand to logic that patient outcomes in the long run will improve. And I'm sure there hasn't been a long-term study on that yet because things are so new. But I think that stands to logic. So you work on the front edge of AI enabled kind of cancer detection and prevention. Is it, we think about AI, and one of the things that people, common themes across all industries is that it's never 100% accurate. Do you have you seen statistics, or is there studies going on about kind of AI enabled cancer detection and prevention and the accuracy of it, how it compares to, simply having an oncologist that's reviewing?
Yes. I think AI has been shown to be more exquisitely detailed and more highly efficient. And this is great in a profession where we see, that there's some backlog of imaging because there's a workforce challenge with radiologists, for example. And so it's been able to supplement in some areas where we no longer have to wait 2 weeks, 3 weeks to get, imaging read. AI is enabling us to do that faster and more accurately. So I do see where it's closing some of those gaps. Yes, and I think that it's really interesting when you look at, for example, in pathology, where we can now take a single microscope slide. And we were just at our meeting in Seattle, and a pathologist said we can take one slide. One microscope slide, and we can look at the tumor and we can analyze where it came from, what treatment it might respond to, whether or not it's likely to be metastatic, what are some of the drugs and the targets that we might use. And so it's really exciting, work that we're doing, especially in cancer care as it relates to AI, from the diagnosis and the imaging to the pathology and the treatment as well.
Wow, that's really interesting, and it's amazing that it can take a small data set like that and extrapolate and find kind of the answers that traditionally would take a lot more work. I imagine I'm far from a doctor myself, but I imagine that it's speeding up the ability to do things like that. And when you talk about radiology and waiting to get the actual imaging back, yeah, that can. I think a lot of people who have ever had to have an MRI or X-ray or CT scan or anything along those lines,
Yeah.
like it's never immediate, like it takes time to get that back. So, and then you have to wait for the doctor to read it and all of that. So I think it's really, really cool that there's a lot of these smaller efficiencies that people haven't thought of, right? When I think when, kind of you mentioned allaying people's fears earlier. I think one of the common things people think of when they hear about AI in medicine is, okay, well, we're going to see the actual patient care being turfed out to AI instead of to actual doctors. And what's the implications of that? What's the actual, stats behind it? Am I better off one way or the other? And I think that once people realize how it's actually being used to kind of add these efficiencies to speed things up and to make it so the process isn't as long, isn't as painful to go through. I think that is go a long way to help, I think, the general public kind of understand how it's being utilized and why it's a good thing.
Mhm. Well, you're not wrong, and there actually are some studies that, have looked at the comparison of the AI doctor to the human doctor, and in particular, the AI doctor was found to be more empathetic, and it was interpreted by the patient. This is really interesting that that AI doctor was giving better care. It got better scores because it simply would say things like, "I'm really sorry this is happening to you." I understand this might be difficult for you, right? And the empathy that was shown, whereas you've got the doctor in the office who's got 25 patients they got to see. So they're charting and, hopefully AI is helping them do their notes a little faster, but they're focused on the chart, the image, the exam, the documentation, close it out, on to the next. Where AI just said, "Hey, listen, that must be really hard for you. How you doing with that?"
So that's so interesting because at
Mhm.
face value, that seems backwards, right? It seems like, I think everybody would assume that the cold computational AI would have worse, bedside manner than a doctor or somebody like that. But you're right. Most doctors, especially in private practice and things like that, they have a lot of patience. I
Yeah.
mean, when was the last time any of us went to a doctor's office and was seen on time? Right? Like pretty rare.
Oh,
So, so I think that when you look at it, when you really think about it, it's not surprising because AI does do things like query how they should respond to certain situations and things like that. So that's really interesting.
here's the thing, we've gotta sort of flip that model on its head, right? To enable the doctor to be able to give more time, to be
Yeah.
able to spend and offer that human touch. And I'll give you an example. In my practice, nobody leaves until you understand your diagnosis, you understand your plan, who's part of your team, and there's this whole shared decision making that happens that can't always happen effectively if I'm typing while we're yet talking about what's going on with your cancer. It seems a little insensitive, right?
Yeah.
And so I think, how we harness and utilize AI, not to replace the empathy, but to give the doctor back the space to be able to be empathetic because something is automatically culling from those conversations what goes into the record and making sure that we've checked all the boxes and done all of the technical components rather than to task the physician with the technical components while AI has the time to sit and say, "Oh, I'm really sorry about that." Right? Like there's something wrong with that. So we got to do a
There
little
is. Yeah.
and I think we're seeing that. We're seeing how do we now take, especially in the clinical exam room setting, how do we use AI to help physicians versus create more work and create a wider divide with patients and that trust just gets further and further away. So I think there's some good opportunities for it, but we have to sit with it and we have to learn how to use these tools. And not every doctor is excited about that. It's not going anywhere.
Yeah, and I wonder if I would love I'm just a naturally curious person, and I would love to see what adoption for these tools and things looks like in the actual landscape. I would love to see if there was, like, specialties that adopt it more or if it's, generational gaps or things along those lines, I think would be really interesting.
Yeah, I bet it's generational. And I look at it the same way we went to electronic medical records, right? My mentors, when I was a student in my short white coat, we had paper charts. And as the student, we always had to carry these charts around or push a cart with all the charts through the hospital. And when we converted to electronic medical records, there was a good bit of resistance from clinicians and there was a mass exodus of those who were ready to retire rather than learn these new systems. And so it does give us opportunity, I think, to innovate and to iterate and to, bring in those individuals who are attracted to that style and that type of practice. And hopefully we don't lose the seasoned professionals and the apprentice model that we need to make sure that doctors are not only competent, but, really connecting with our patients and our community.
Yeah, and I think that brings up another kind of topic of discussion, which is how should hospitals and practices prepare their people, not just the tech itself, but their people for AI adoption?
Ooh. Um, I would say very methodically and I think in an ongoing fashion. And I will just use the example of the electronic medical record and the AI tools. That training is, maybe 1 or 2 sessions, and then you're on your own there, to use it and to figure out how to integrate it best with your practice. But I think that we can do a better job of really sitting with from design itself. And I see this in the way we're designing tools that are incorporating the clinicians, but not only the design, but the implementation. And then to check in and say, okay, how's this working for your practice? How can we tailor this a little bit better so that it better meets the needs of you, the clinician, but also the patients that you serve, right? We can't just look at, helping the doctors, but there are some unique considerations that, AI can help us with from a cultural competency standpoint, from a digital divide and health literacy standpoint. So all of those great tools need to be explored and need to be taught and then used and monitored, evaluate how we're succeeding at that.
Absolutely. And I think that, with the training on how to use it, there's also probably a good amount of training that with anything electronic with medical around compliance and risk, right? Because we're you're inputting or analyzing PII and HIPAA protected information whenever it comes to anything in healthcare. So, what role does patient privacy play in AI becoming more involved in healthcare?
Ooh. I think it depends on the level. I mean, patient privacy is always paramount, but how we're using AI doesn't always invade or infringe upon patient privacy. In the exam room setting, we let patients know, listen, I'm going to be using AI to support my note taking, and so do I have your permission? This is who you are. Do I have your permission to do this for note taking? And if there's anything that you don't want included in that record, in that clinical encounter that we're documenting, please let me know. And so I think that opportunity to have, some autonomy and some agency of the patient is really important. But when it comes to things like, sort of large language models and looking at validation of complex algorithms, much of that information is de-identified. And so there's less of a concern regarding the actual patient's privacy, and I think I want patients to know that because I want them to be involved and engaged in that process because, if you train AI on a foundation that is underrepresenting certain populations, you're going to get these outputs and these models that we dress up like, this is, data driven, but it's actually just perpetuating, disparity, right? It
Yeah.
doesn't fit bias, it scales it.
And there's, historically throughout medical history, there's a lot of examples of that, not from an AI standpoint, but from underrepresenting, certain demographics in trials for medicine and for different things. So it that is incredibly important. And I think that, you know, you make a very, very strong point there. Um, what advice? So you are one of the medical leaders that are really uh, riding the frontier wave, so to speak, of AI adoption. Um, what advice would you give to other doctors who are hesitant or uncertain about integrating AI into their work or their diagnoses? Diagnoses.
My advice would be that we don't have to be an expert to begin to use these tools and integrate these tools. And, candidly, I'm not the best at integrating AI into my note taking because my conversations with patients are so vast. We may cover things like nutrition and sexual wellness. We may cover, psychosocial things and all these sort of clinical, non-clinical things are intermixed into conversations that it can be challenging for AI to parse out into a very succinct office note. And so my challenge is working with AI in the office setting to make that happen. On the innovation side of things, believe it or not, the things that drive success in AI and scalability isn't always the sexiness of the technology itself. Many times it's the pragmatic question that you're aiming to solve. Right. And I'll give you an example in mammography, for example. No woman ever said, hey, if you add AI to mammograms, great, sign me up. I'm going to do it. And the people who don't want to do it have their reasons that have absolutely nothing to do with artificial intelligence. And
Absolutely.
so, right, looking at the very pragmatic issue of adoption and creating tools and using AI to support and expand that landscape is what's exciting to me, especially in early detection, because, 2026, we've got to have more tools. We've got to have more technology that reaches people where they are and that centers and listens to the populations they want to serve. And that's what we do with BEXA.
That's fantastic. Could you tell us more about the work that you do with BEXA?
hmm Sure. So BEXA was a technology that we acquired. We did not invent it, and it is centered around currently two modalities for healthcare delivery of early detection in places and for women who either won't access, cannot access, or perhaps are too young for mammography. And so it utilizes two devices. Currently, I've got one of them here. This is the BEXA sensor. And on the bottom of the sensor, there's 192 sensors arranged like a lattice, and it glides along the surface of a lubricated breast, looking for changes in the stiffness of the tissue. So the elastic nature. Think about it similar to a topographical map, right? We're not creating an image of what's inside. We're not looking in. We're looking for changes along the surface that would suggest there are masses within the breast
Oh,
tissue.
that's interesting.
It's very interesting because the way it was designed was by querying women. Why aren't you doing the thing that could save lives? If this thing you do every year, right? If 1 in 8 people get diagnosed and there's something you could do, why aren't you doing it? And you know what women said? Pain, right? I don't like the pain. It's 28 pounds of pressure. Radiation. I'm afraid. I'm concerned about radiation. I don't like the setting. I've got to go into this setting and sit in this gown in this room and, get something done. And nobody really talks to me about what they find. They just send me out. And then I get these delayed results that say, hey, something was seen. Call this number, make another appointment. And so for the next 2 weeks to 2 months or longer, depending on when you can get that next thing, people are scared to death that they've got cancer
Yeah.
when the majority
It's
of people don't have cancer.
yeah, it's impersonal, it's painful, it is an awkward, uncomfortable situation, and the
Yeah.
results, that waiting period, is scary. So my
Yes.
you know, my mom just finished radiation and chemo for cancer, and just got through all of that and waiting on the long term um, outcome. And it's the same thing. It's
Yeah.
the period before she started and before it was diagnosed, and now the period from then onwards is it's scary for her. It's scary for the families.
Yeah.
Like
Yeah.
obviously, yeah, I was very worried about my mom during all of that. So yeah, it definitely having kind of that immediate result, or that
No, no.
immediate kind of help in diagnosing the issue is big. You know,
You're spot on because, that's sort of why women don't do it. It isn't always that they can't get to a radiology center. I mean, you look at, Delaware, we put rad nets or radiology centers in Walmart. And women
wow,
said, "Oh, you know what? I'm busy. I'll get to that later." We always put everybody else first, right? Or we're worried about the cost, or we've got to miss another day of work to get the next study because the first study was inconclusive. And so we said, "Well, what if we put two things together? Because let's start with the end in mind. If you don't do anything, then what do you get? You got to wait until you're able to feel it, right? My
mhm,
10 fingers, as magical as I think they are, the ability of these 10 fingers to find a breast cancer is like 50-50 flip a coin accuracy.
wow,
So, can we use AI to digitally transform this exam? And that's exactly what this does. And then we said, okay, but women don't want to wait because they don't want to get the follow up thing, or they may have to wait 2 months, or it's going to cost them more money. So, can we do the next thing? And can we at least tell them what it is and what they should do about it in a single encounter? And so AI is supporting all of this, right? The 10 fingers and the two devices to be able to help women know if they've got a mass that needs something further, how suspicious it is. And then we're looking at, well, how do we scale this? And how do we get it in places where women have issues of
mhm,
access, right? Or they've been sent away by their doctors because they said, oh, you're probably too young for cancer. When, well, like I know, cancer doesn't really know an age. There's no age cutoff for it, like there's guidelines cutoffs.
yeah. And there's obviously in different age groups, there's higher prevalence, but that's not to say that younger couldn't be, have an issue with a specific kind of cancer. So
Yeah. And the fastest growing population of people getting cancer, breast, colon, uterine cancer, lung cancer, are actually really young. They're in that 29 to 49-year-old age range. And so I think we've got to start to look at how we can use tools that can tease out what's going on in younger people who don't fit those classic profiles. And AI is a great use case for that. So I love what's happening in this space because we're seeing it now be able to, look through the density. We're seeing it be able to look at, the blood samples or urine samples or tears, saliva. Can we get to the point of finding cancers earlier, but also ruling people out who are otherwise healthy and not scaring them into these settings where it's like I'm checking for cancer every year when majority of people won't have it.
So that's actually really interesting. And, something that I've dealt with before is health anxiety, right? I'm knock on wood. One of the I'm the only member of my immediate family who hasn't had cancer or some other kind of problem. So I'm every 6 months, I'm like, I should get a
Mhm.
blood test. I should go get checked out. I should do X, Y, Z. So having something that can help rule that out long term, I can see the value in that in helping kind of put that anxiety to rest, at least for a time period. And especially if it's a less invasive kind of kind of process or testing would be really powerful. Um, Something that I wonder, and I'm sure a lot of people listening to this wonder, is what healthcare will look like in 5 to 10 years if AI adoption continues at this pace. And I know that's kind of like asking you to predict the future, right? But I would love to hear what your take is, what you think will happen, what you think is on the near horizon versus maybe some long term dreaming. But
What I hope will happen is I hope that it can enable us to, um, have more equitable outcomes. And I don't just mean that from the perspective of sort of a racial equity. I think about it in terms of age. I think about it in terms of, drugs and treatment and, precision wellness, right? I think AI is gonna allow us to move a bit faster, certainly in the clinical research space, because we can now create these digital models that can help us to test out how treatments are working and iterate faster on trials and maybe change a few things so that we can get to the point of having newer and faster drugs on the market. So hopefully that affects outcomes. I hope that it addresses sort of the implementation problems that we're seeing in healthcare, and addresses misinformation and disinformation and health literacy. So I'm really excited about all the different ways that AI can be incorporated um, to impact healthcare and to decrease spending and to decrease some of the barriers and the load, the burden that we're seeing on the healthcare system. Because right now, I'll tell you that the healthcare system overall, it's a very fragile ecosystem right now for all of the aforementioned reasons. And so we need some help and we need some support. And I think AI is going to be a great tool for all of those.
yeah, and I think that you're spot on. I think that there's a lot of opportunity for AI to improve everything from people researching about our side. What we do here is primarily marketing, and it's search based marketing, and something that we see a lot, and we're seeing a bigger pickup now in, is pharmaceutical companies that are concerned about how AI is representing their drugs. So an example of that, for a while, AI was kind of saying there were use cases and saying that there were side effects and things like that of specific drugs that there weren't, right? It was
Mhm.
misrepresenting, it was saying different data sets that may have, kind of led to one conclusion or another, and it was incorrect. And that poses a significant risk for people that are learning through that and from drug manufacturers who don't want their drug to be, presented that way. So something
Yeah.
we've seen gaining an uptick is pharma companies wanting to take charge and take control of how their brands are appearing in AI search, whether it's ChatGPT,
Mhm.
Google AI overviews, Gemini, Claude, whatever. So that's become a big topic. That goes from pharma, it goes down to retailers as well. Walgreens and
Yeah.
CVS are both looking at that, and they're worried that if somebody is recommended a specific OT, over the counter drug for something, and recommended to buy it there, but it's not correct, or it said it was good for people with high blood pressure when it wasn't, or something along those lines, then that's a significant issue that can potentially open up liability down the road. So
Mhm.
there's a lot of areas that this is becoming more and more focused on, and I think that's good for the consumer at the end of the day, because and good
Yeah.
for the patients at the end of the consumers, patients at the end of the day, because people need to be able to trust the information they're getting. So, something we do is we kind of verify, and we have this whole NextNet AI app that helps people kind of take charge of how their brands are appearing in AI search,
Oh,
which is
wow.
my shameless plug for for our podcast. But there's a lot of applications for that, for making sure that people's company's actual, services, products, in a lot of cases, drugs, things along those lines are being accurately represented, which is super important because, again, patients need to be able to trust start to finish, whether they are researching a diagnosis they got, whether they are researching a drug that they were prescribed or that they want to talk to their doctor about, all the way through to having actual, labs reviewed or things like that. So
Mhm.
um, I guess that brings me to that whole talk about what healthcare will look like in 5 or 10 years. Um,
Yeah.
what's one breakthrough you're excited about that most people aren't talking about yet?
Ooh. Um while I stall and think about that answer, I'm gonna go back. I'm gonna go back to what you said, right? Because I think you mentioned this sort of need for oversight, and AI governance is a huge thing, right? We're talking about who governs and how and why. And when I liken it in my sort of simplistic mind to search engine optimization, right? Where, depending on who optimizes, how much they pay is where you end up on the scale of what's the most readily presented data to you on, let's say, Google, right? And the risk isn't that AI is not going to work, but at the patient level, I worry that it's going to work for some people and fail for others because we assume the math is neutral now.
Yeah,
We assume that the models are validated. We assume that all the data is equal and that it's equitable and that it's accurate. So you're right. Managing and monitoring the actionability and the accuracy of data for AI is something that I counsel patients about every day. If you're going to ask Chat GPT, do not allow it to make decisions for you. Do not assume that the answers you're getting are correct, but it can be used to spark a conversation, and
absolutely.
that excites me.
Something that you just said is it reminded me of the early days when people would Google a symptom like I have a cough, and it
Hmm.
would pull up a WebMD article that was like, you have lung cancer, or you probably have pneumonia, or you have,
Exactly.
hantavirus,
Right,
so,
right.
and it's like, well, no. And that was a whole lot of, people that got really anxious. And I'm sure a lot of people ran to their doctor, and the doctor was like, oh, you have bronchitis. And they're like, no, WebMD said that I have pneumonia. It has to be
Mhm.
that. So I wonder how much of that will happen as people adopt this, and kind
Yeah.
of get to that point of learning to say, like, hey, this is a research tool. It's not as good as talking to your doctor, right?
Sure.
I am great with Chat GPT. I am terrible with medical knowledge. So I would never dream of, going to my doctor and saying like, "Hey, I've been diagnosed with this by ChatGPT." It would be crazy. So I think that for anybody listening, yes, it's a good research tool. Yes, it can help you learn about things that may be affecting you, or medication, or procedures or anything like that. But it definitely, the end of the day, being able to have those conversations with your doctor is very, very important, because they have seen a lot more. They have been through actual medical school and they can, relate to you, and kind of
Yeah.
help you through that process. But the question to get back to it was, are there any breakthroughs that have happened recently that you're really excited about?
Hmm. Breakthroughs that I'm excited about. I am excited to see AI being used in precision care. I got to go back to cancer because I'm an oncologist, right?
Of
But
course.
we're looking at precision in screening, right? We can pick out and understand who's at elevated risk and who needs to screen twice a year instead of once a year. We can look at the signatures in blood and imaging and on and many other ways to determine where we are in terms of the personalization that a person needs. And I see that personalization happening all throughout the entire ecosystem. And I'm excited to see it happen in survivorship and in wellness because I focus a lot on that. Even though I treat cancer, people want to be well, they want to feel well. And looking
Yeah.
at tools to help them do that and precision and personalized tools, especially if you've had something complicated like cancer, is really exciting to me.
Yeah, I think that's spot on. And you mentioned the wellness side being something that you're passionate about as well, and survivorship and wellness long term. Something that I mentioned in the intro that isn't AI related, or at least I don't think it is. You're the founder and CEO of Still Rise Farms, which, if you remember the intro, is a 40-acre wellness and research incubator bridging evidence based medicine with integrative health. Could you tell us more about that?
Sure. So, in response to my patients' questions about their diagnosis, because I'm the first person that they see who tells them they've got cancer and what we're going to do and what's our plan. And then I'm the person who sees them after it's all over and says, okay, now how are you doing with this? And they all want to know, am I going to need chemotherapy? How can I do this naturally? What should my diet look like? And everybody's got this different concept of holistic, whatever that means to them, holistic. And it's so broad and so
Mhm.
not evidence-based and so not personalized, that for me, it's exciting to be able to have a space here. We do call it our living learning laboratory because we incubate ideas and concepts in education and wellness. So we have patients come out, whether they've got cancer, chronic illness, or they just wanna learn about integrative ways to reduce risk for these things, and we customize educational courses for them. So our gardens, for example, are classrooms because they're not used to just sort of grow and sell at the farmer's market, but let's teach you about soil, about nutrients in our food and ways to combine those things. And we started to now really dive into the research and look at it as an opportunity to generate real world data. And that's exciting because it's not sort of prospective, wait 15 years and see how people are doing, right? We can look at patient reported outcomes to nature based therapies. Try something. Try it 4 times a year, see if it works. And so it's become a really exciting place for research as well, and that's something that I absolutely love because the science behind why our meals, our movement, our mindset help our medicine, that science is there, but it needs to be strengthened.
I love that. And to your point about everybody having a different definition of holistic, I think part of that is due to my own profession, marketing. We've seen a lot of things being marketed as, a holistic remedy or all natural, and a lot of those labels that don't really mean anything at the end of the day, and a lot of them misrepresent in the worst cases. So I think that that's probably part of it. Is there's probably some version of that impacting people's perception, and I love the fact that that this is something that you're passionate about and building out, because you're right, strengthening that kind of research behind it is so incredibly important, because at the end of the day, what you put in your body is so important, right?
Yeah.
It's something my mom always used to say was junk in, junk out, right? So if you're eating junk all day, you're going to feel like junk, and, you're going to not be great. Whereas, making sure that you have the right nutrients and you have the right vitamins and things along those lines are so important.
Mm.
So, I a while ago, I had an issue with an irregular heartbeat, and I was like, "Oh man, like, am I?" When you're in your 30s and that happens, you're like, "Oh my god, is this a heart attack? I don't know. I don't know what a heart attack feels like." And it
Right.
turns out it was just low potassium, and that can happen and totally
Mhm.
benign and nothing to worry about, kind of deal. So,
Wow.
but not knowing that and not, watching what you eat, and,
Mhm.
my excuse is I have a 2.5-year-old and an 8-month-old, so my time goes to work and children, not eating healthy.
Yeah.
But
Yeah.
yeah, it's very important, and I'm sure that especially when you're going through something is challenging on the body as cancer, and you know cancer treatment that goes along with it. It must be so important to eat well and to have proper nutrition. And I love that this is something that you're passionate about and have started.
Thank you. It's really exciting. I expected this conversation to go differently. I thought this was going to be related to energy drinks. I have to be honest, because so many people, right? We drink a few too many, and we get palpitations.
Mhm.
And you're right, you don't know. But on the subject of wellness, people are living longer, whether they've got cancer or not. People are just our lifespan is longer. We want our health span to be good.
Mhm.
And so the opportunity to look at how AI can support even a farm like this, and ways to personalize that care is something that we're looking into. And I think I forgot to mention one thing as far as what's exciting to me, especially as it relates to things like early detection, because we've seen some global bottlenecks of innovation. What works here in the city and the metropolitan area doesn't work in the rural areas, and what works in the U.S. doesn't translate globally. And I think that we have the real opportunity using the tools and the technology to create systems and structures that actually work for people in all of these settings. And that, for me, is like my big great hope from AI, because globally the cancer statistics are um, concerning and overwhelming, and everybody's not going to get a mammogram. So how do
Yeah,
we take things to the people and the populations that need them the most? I think it's happening, and it's happening at like the speed of now, and that's super
that's
exciting.
fantastic. Yeah, that is super exciting. So we are coming up on time. So to close out, anybody that's a healthcare leader or interested in healthcare that's listening to this, I would think about what the first step you should take with AI is to help your practice out. And feel free as always to comment, talk about it, tell us how you feel like implementing it into your own practices or things along those lines. And secondly, I just want to say thank you again so much, Dr. Mo. It's been fantastic talking to you today. I'm really honored to talk to somebody that cares so much about people and works in such a difficult industry as oncology. I have a lot of respect for the work you do, especially with my mom recently going through cancer treatment. I've got a lot of respect for you and your profession. So thank you very much. And before we get going, I always love to give my guests the opportunity to tell people where they can find them. So if you want
Wow.
to, any shameless plugs, anything you want to talk about here, now's the time.
Oh my goodness, absolutely. So I think first, you can find me on all social media platforms. I'm Dr. Monique Gehry. You can find my farm, Still Rise Farms, on all social media platforms, and stillrisefarms.com. Folks might be watching and wanting to learn more about BEXA and bringing early detection solutions to them. Our website is mybexa.com, and we work directly through HR and through self-employed insurers to make sure that we cover the people who are working hard and maybe not accessing that early detection solution. And we expand, right? The goal is always to expand. So whether you've got, mammograms and buses coming on site, you got to get your population into the target zone of getting everybody into something. And so that's where BEXA comes to stand and fill in those gaps. So if you are, a company of 200 or more employees and interested in talking about those solutions, please do find us at mybexa.com. And we're just excited to share with you and to look at the ways that AI is revolutionizing, healthcare in the clinic and in the community, and bridging some of those gaps. So thank you for having me.
Of course. Everybody listening, if you like this episode, please make sure to follow us, to leave a review. And as always, please comment on topics that you would like for us to cover. It's so helpful for us in sourcing new guests, in trying to plan out the things that we talk about with guests that are multi disciplinary discipline kind of focus. So please make sure to comment on your streaming platform of choice. And thank you again, Dr. Mo, and we'll see you next time on The Crawl.